so the next supplement that I want to talk about is actually something called Fulvic and Humic Acid. This is probably a new one for a lot of people. Kevin and I have been taking it for a few years, and the reason why I would strongly suggest this one is because it's a great transport system for helping you to absorb. So it's actually ionically charged, which is great, and what it does is it allows you, or it helps you to actually absorb other vitamins and minerals more effectively. So this is why I would recommend this. The other thing about it is that it actually carries, it's known to carry 6 times its weight in minerals. So I prefer to take a fulvic humic acid as opposed to a mineral supplement to increase all of my minerals. And again, like I said before, I take magnesium on its own as well. But if you're looking for a mineral supplement, this is definitely one you want to check out. The other thing that I personally love about this is, again, it helped with muscle spasms and eye twitches and all that. I feel as if when I'm taking this, it's helping my other magnesium or my other supplements, like I said before, to be more absorbable. It's also great. It's a great supplement, and I often say this kind of term, and I can't really remember where I heard it, but nutrify before you detoxify. And this is a really great one to start with. Even if you don't do all the others, which of course, like I said, a few of them I consider the absolute musts. This is definitely one of those, but it has also been known to stimulate digestion. In itself, it's a natural detoxifier that helps to eliminate pesticides from the body, heavy metals, herbicides. It also is great at increasing your energy levels, which was something I struggled with for years. It also helps to restore the electrochemical balance of our cells at a cellular mitochondrial level, which is kind of out there, but that's why it gives you energy. It actually increases the mitochondrial energy, and that's something that's very important in a supplement that can even make its way into your body at a cellular level. So this one is great at doing that. The other thing is it's a powerful electrolyte, which for any of us that are struggling with any type of disease that gives us chronic diarrhea, it's amazing to have a powerful electrolyte that you take on a daily basis. But the most important thing of all that we kind of started taking this for was for the fact that it could benefit us in actually helping to fight and kill Lyme disease. And it is a less invasive antimicrobial and a natural fungicide, so it'll definitely help with infections. Like, I know you can put it on your body topically for, topical skin infections, but taking it internally will definitely help with fighting off bacterial, viral, and of course parasitic infections. I really noticed a difference taking this product. I really noticed a difference with my candida after taking a fulvic humic acid, and I think that's another thing. So if you're looking to kind of, get rid of candida, and you kind of want to maybe heal the stomach or heal the colon or heal like ulcerations or gut dysbiosis, I think this is a really great one to start with, and then you can start putting some other supplements into your daily regimen. But definitely check it out if you've never heard about it before. It comes in a liquid form in most cases. I have used 2 forms now. Actually, I've used 3. I used one that you add these drops to your water, and this one I'm not really fond of because it can cause your teeth to stain. So actually, I didn't notice it on my teeth, but I was noticing it on Kevin's teeth. His teeth were going brown. So if you don't take certain fulvic humic acids, and the other thing is if you're taking a fulvic humic acid, it honestly will take on the chemical makeup of whatever it's in. So like, you need to drink this out of a clean glass. You also, if you want to avoid staining your teeth, you'll also need to drink out of what they call a glass straw. So we had to purchase a glass straw to take this mineral so that our teeth wasn't getting stained. So we kind of stopped taking that formula. I have found another formula by Sun Warrior. It only has fulvic in it, which I take that when I run out of this other one, which I will link down to below where I get it from. But the best one that we've taken to date is one that you take sublingually. So you just actually take a few drops underneath your tongue every day, and that should be enough. And again, it keeps it from staining your teeth. You're not having to have a big jug of one that's already pre-mixed with water. Because the other thing is you cannot mix fulvic humic acid with regular tap water that contains fluoride, because it will make the fluoride even more potent. So in that case, you would have to drink it with like a reverse osmosis water or a highly filtered water. So in that case, I don't really recommend it. I actually recommend either buying one that's already pre-mixed for you or taking one that you can only take a few drops under your tongue sublingually. I hate that word. I can never pronounce it correctly. But anyway, it does taste very metallic-y, so that's quite normal. So if you get one, it doesn't taste very good. But again, a few drops under the tongue, anybody can handle that. Next product that I want to talk about, or supplement, is actually not really a supplement, but you can find it in supplement forms, or you can actually ingest the herb, which is not going to be as potent as taking the active ingredient, which is curcumin. The actual product I'm talking about is turmeric. Turmeric is by far probably one of the best anti-inflammatory herbs on the planet. I mean, there are others out there, but this is the one that seems to be the most common. This is the one that probably has a lot of research has been done on using turmeric as an anti-inflammatory. So actually, even when I worked for my company, 2 or 3 years ago, when I was working within the industry, we created an entire line for irritable bowel disease, and primarily the main ingredient was turmeric. So it just goes to show you, a lot of people have jumped on this bandwagon of taking turmeric as a natural anti-inflammatory. Again, it is found commonly in Indian and Pakistani cuisines in their curry bases. It's usually what gives that curry its vibrant yellow color. I will warn you now, I cook with curry all the time. Do not get this stuff on your carpets. Do not get this stuff on your countertops. Do not get this stuff on your clothes or on your skin, because it does stain. It is horrible to use in that sense, and it will stain everything. I found some ways of getting it out of certain things, which we won't talk about here, but I would strongly suggest you use it in your cooking if you can actually. I know some people, like my mother, does not like the taste of turmeric. I've gotten quite used to it, and I don't use very much of it, but I do use it very often throughout my dishes. I will sprinkle it in my chicken soup. I will sprinkle it on chicken when I'm making. I'll sprinkle it on fish. I sprinkle it on everything. So I would strongly suggest that. I don't know how therapeutic of a level you're getting when you're eating it in your daily food, but I'm assuming it's more of a cumulative sort of thing, that if you eat it every day, it'll give you benefit. But in that case, the studies that have been done is about taking a therapeutic dose of the actual active ingredient in turmeric, and the active ingredient in turmeric is curcumin. And I believe the therapeutic dose for taking curcumin is about 1 gram per day or more, if I'm not mistaken. So really, if you've tried turmeric, that's the other thing. It's curcumin that you really want to go after, or something that has a high base of curcumin in a turmeric supplement. The other thing is, turmeric's very hard to digest because it is a warming herb. So if you were somebody struggling with specifically stomach issues, you'll find that sometimes turmeric can cause things like GERD or acid reflux, or just like a burning sensation in your stomach. Those were all issues that I had in the beginning. I did have to address my stomach issues other ways by using things that were much more healing to the stomach, like Fulvic and Humic and bentonite clays and stuff like that, until I could start ingesting these more potent herbs. The other thing to remember about turmeric is that it is not, even in its active ingredient form, it's not very absorbable unless you take it with black pepper. So for that, you can actually, what I would suggest is you actually look for a supplement that actually has both of those ingredients in it. So it has the curcumin or the turmeric at 95%, as well as a mix of black pepper. Or what you can do, and I've heard plenty of people who say that they take their turmeric and then they swig back some black pepper or a couple of black pepper cornflakes. So either or will work for you in order to make you absorb that. The thing about turmeric that's really great, I don't know if I mentioned that, it's one of the best anti-inflammatory herbs that you can actually consume. People have used it for many years to control things like rheumatoid arthritis, so it should help with arthritis if you're taking those therapeutic doses, which is more than 1 gram per day. So it is said that if you take turmeric on a regular basis, it can prevent heart disease, it can prevent cancers, and it can also prevent a lot of different brain diseases. So that was another reason why we got super serious about taking turmeric on a regular basis, especially for Kevin, because he was having a lot of issues with the Lyme and his heart, and of course a lot of things going on with his brain, which scared the crap out of us. So I think I pretty much covered everything on turmeric. I think we'll have to go on to the next supplement, and I am so excited to talk about this one next. because this one has been an absolute godsend for me. What the next one that I'm going to be talking about is something called serrapeptase. Serrapeptase is actually an enzyme that is extracted from silkworms. And I absolutely love this. It's classified as a proteolytic enzyme. Excuse me. It's classified as a proteolytic enzyme, and that is not to be confused with digestive enzymes. However, this does do certain types of digestion in the body. Digestive enzymes are primarily used, and I've talked about them before, primarily used to digest your food, so then that way you're better able to absorb your food. This is a proteolytic enzyme, and what a proteolytic enzyme does is it's basically like a free scavenger, and it'll go into your body and it'll digest certain types of proteins that are created by certain things like bacteria or viruses or parasites. And this one I absolutely love, and anybody that has Lyme disease or any type of scar tissue or anything like that in their body should really consider taking something like this, because the other thing is it's been known to digest the proteins that build up in scar tissue. But the one thing that it does do for digesting these particular proteins in Lyme is Lyme's patients struggle with two things, two very severe things that the spirochetes kind of like to hide in. So the thing is, the reason why it's so hard to treat the Lyme spirochete, or which is called Borrelia burgdorferi, is because it's a very intelligent spirochete. It's a lot like a syphilis spirochete, where it likes to burrow itself into tissues and into different organs in your body if you've had the disease in a chronic state and it's surpassed like the blood system, and then it's made its way into your organs. So it burrows itself into things. It is also really good at hiding away from antibiotics, which is why I'm not a firm believer at hitting Lyme right in the beginning with antibiotics unless you've had a chance or you've had some time to deal with what's called biofilms and cysts, because that's the two things that Lyme likes to create within the body. It likes to create a home in the form of biofilms. And basically, biofilms is, from what I understand, biofilm is exactly what it's kind of how it's described. It's a film that actually harbors different types of viruses, parasites, and bacteria, and they basically come together to create like a home for themselves and then they protect themselves in this film that's created up of these proteins. So the problem with that is now that they're protected, parasite at this point. And so what you need to do in order for antibiotics to be effective, and I hope anybody that's seeing an LLMD or ND, which is a Lyme literate medical doctor or naturopathic doctor, I'm really hoping they've taken the time with you to explain and go over biofilms and cysts, because cysts is the other thing. Sometimes, and I've noticed this with Kevin and I, both of us have had cysts. I have had cysts in my inner thigh. Kevin obviously had a cyst in his mouth. I believe that I've had cysts in my breast. I've had cysts throughout my body, and I've had problems with my lymph system. This is another place where spirochetes likes to hide, in which I strongly suggest people doing that have Lyme disease strongly suggest that you continuously move the lymph to get these bacteria out of the lymph system. But the cysts is another thing that they tend to do. A lot of Lyme's patients will complain saying that they've developed, after being infected with Lyme, they've developed cysts throughout their body. And the reason why is, again, this is another way that they like to hide away so that you can't hit it with antibiotics or even natural antimicrobials or fungicidals and all that stuff. So what you need to do is you need to take something that will digest the protein in that cyst so that you can break open that cyst, and then you can start hitting those spirochetes or that bacteria or that infection. It doesn't necessarily need to be Lyme itself. It could be other infections too, like Babesia and all the other ones that come along with Lyme, or just general infection, because as I have said before, I believe there is a strong component in all diseases that there is an underlying infection that's happening. So what you want to do is you want to break open these homes to allow these bacteria or parasites or viruses to become almost susceptible to being killed off by taking all these other types of supplements, or whether you do the supplement route like we've done with tinctures and stuff like that, or you go the route of doing the antibiotics. So important for that reason alone. The other thing that I love about this product is it is also classified as an anti-inflammatory, and for me, I did have to increase the dose. On the bottle, I believe it says to take one of these a day. I had to take, this is the one I was saying, I took like 4 to 6 a day. But it has also been really, there's been a lot of research to suggest that it acts almost just as good as taking anti-inflammatories. In the case, like for instance with my Crohn's and colitis, I was taking 12 to 14 anti-inflammatories a day in order to control my illness. They have said that serrapeptase, based on a therapeutic dose, can be just as good as using things like 5-ASA or Pentasa and stuff like that. I can vouch for this, that I believe this is when I was very confident that I could eliminate my medications altogether. And the other thing is it does all this without causing any other damage to the body, because NSAIDs, people that take those on a regular basis, or people that take anti-inflammatories on a regular basis, tend to destroy their stomach and end up getting ulcers that way because of taking these high doses. But this one acts kind of similar to that in the sense that it will reduce your inflammation without any of the bad side effects. And the amazing thing, I think the biggest side effects that you can get from enzymes is that you can have some digestive upset. And I love this one particular formula that I take because I've never had any digestive upset with it. And I think that's because it's actually made with something called a TheraBlend of enzymes, so those help you to absorb it. I believe there's a little bit of calcium in there just to kind of coat the stomach as well, which I'm just going to come out and say it. The name brand that I use is by the company of Enzymedica, and the product I use is called Ceregold. So that's another reason to use it. It reduces inflammation. I think within about 6 months, I noticed a drastic change in all of the inflammation that I was feeling throughout my body. And when I say throughout my body, I didn't just have the problems with my stomach. Like I've said to you before, I herniated the discs in my back and my neck. I felt taking this supplement alone with some of the other natural anti-inflammatories, as well as using something by the name a therapy called Nuka Chiropractics, I have literally been able to reverse majority of the pain that I was feeling in my neck and my back, and I have never had surgery. I know other people who herniate the same discs that I've herniated in my body, actually, and it's always ever one, and they've become completely debilitated for years. Most people even opt to have the herniated disc removed and to have their spine fused, which in itself is a very dangerous procedure. And you know, having anything in your neck and having to do surgery in your spine, in the cervical spine area, there's a good chance that you come out of that surgery as a paraplegic. And I wasn't ready to even play with that idea. I wasn't even ready to take that chance. So like I said, this product has helped me immensely. The other thing I want to mention here, and Kevin and I both take this, the other thing I want to mention here that I absolutely love about this product, and I didn't even take it for this reason, but just to prove how powerful this supplement can be if you're taking a high dose of it, I had picked at a cyst when I was a teenager in my inner thigh. I had it there when I was probably 14 or 15 years old, and I'm the type that used to pick at everything. When I had acne on my face, I picked at that too. So I developed this cyst on my inner thigh, and it was probably the size, it wasn't a very large cyst, probably about that big, I would say. And it was close to the surface, and I just picked at it and picked at it and picked at it until one day I burst this cyst, and it created a very large hole. It took probably about a year or two for this thing to completely heal over. But the one thing that happened from picking at it all the time was that it created tons of scar tissue, like not only on the surface, but internally. I had a scar underneath there that felt like almost the size of a marble. So when I would feel it, I would have this lump, and I actually ran it by the doctor because I was kind of concerned about it at one point. I know I'm always concerned about all these lumps I have. So I went to the doctor and I asked her, and she said, well, it looks like you've had something here. And I said, yeah, well, I had a cyst, and I picked at it. And she was like, well, that's scar tissue that's formed under the skin. So anyway, to make this long story short, I started taking this supplement. I knew that it was really great at digesting things like the biofilms and all that, but it's also great at digesting scar tissue. So the funny thing for me was that I hadn't even realized, but I was taking a shower and I went to go wash in that area, and I noticed that I couldn't feel the lump anymore. I'd only been on the Ceregold for, I believe it was 6 months, and in that amount of time, this product had completely digested a scar tissue that was over 20 years old. If that isn't amazing, I don't know what is. So for that reason alone, I continue to take this product because I thought, I don't know what kind of damage this Lyme is doing all throughout my body. I mean, and if it is creating this damage, it's obviously going to go in there, and it's going to try and eat away at any of that inflammation as well as that scar tissue. So I'm not necessarily saying that'll happen for you, but if it can work for you, why not give it a shot? The other thing is, people who are struggling with any type of arterial plaque or anything like that, and you've got the early stages of heart disease, you might want to look into that, because I think most of the studies that were done on serrapeptase was showing a lot of benefits towards those people who have things like arterial plaque. It's also been known to digest that as well. So another thing to look into there. So again, I found an immense difference with my Crohn's colitis by taking this supplement alone. So if you're somebody struggling with that and you're already on things like Pentasa or 5-ASA, or even if you're in the stages of taking steroids or immune suppressants, you may want to consider supplementing with this product.